Hello, welcome to Heavily Circle, and this is our podcast. And my name is Abner, one of the nurses, and I'm going to talk about today about one topic, and it's about prostate cancer awareness. We're going to talk about signs and symptoms. We're going to talk about ways to prevent this type of cancer, and also we're going to talk about treatment. To begin with, one in every 41 men in the United States is being diagnosed with prostate cancer. Okay, and now we're going to talk about who are at risk. Well, people who are overweight, that does not exercise, don't eat right, that eating a lot of fat, people, guys that smoke cigarettes and drink alcohol. Also, African American males tend to have a higher tendency to have this type of cancer, and the elderly men. Now, don't confuse the fact of inflammation in the prostate with prostate cancer. Ways to prevent that: make sure you exercise, you eat right, you eat your fruit, your vegetable, avoid smoking, avoid drinking alcohol, and also make sure you have to get checked. If you are at the age of 40, it's time to get checked. And we're going to talk about signs and symptoms of prostate cancer. Number one is erectile dysfunction. The problem with erectile dysfunction that many people in the United States are suffering with diabetes, cholesterol, heart disease. They take medication for anxiety, depression, blood pressure, or even for the heart, which will affect the male organ and will cause some type of erectile dysfunction. And the problem with this is that some people that experiences this type of illnesses will bypass and forget about all that and don't get their prostate checked, because they might think, okay, it could be that I'm taking my depression medication, could be my diabetes has affected me, but in fact, it could be prostate cancer. So, couple of tests that a male can identify, can get checked for this type of problem. Number one is the digital rectal exam. I know many guys out there, they don't like the idea of having a digit inside their rectum. I completely understand, but this is the first way that a doctor could palpate your prostate. Your prostate is the size of a small walnut, so it's small in size. Once the doctor go in, can palpate, can check whether you have inflammation or not. And if you have inflammation, then the next step is going to be a blood work, where they're going to check cancer levels in your blood, and they will proceed with a biopsy, where they insert a small camera in your rectum and they're going to extract tissue, and they're going to send it to pathology and get it analyzed. Now, if indeed a male get cancer, there are a couple of treatments out there, and number one could be the biofreeze. Well, they're going to go into the prostate and they completely freeze the prostate and the cancer, and that's one way to get rid of the cancer. Number two, they can go in there and they could burn the prostate completely with the cancer. They may extract with surgery the prostate also. The patient may have to go to a series of radiation therapy. Now, the last one I'm going to talk about, radiation seeds. It's a small, at least like a grain of rice. The doctor is going to go there, implant the seeds in the prostate, and within time, the cancer is going to be killed and the inflammation is going to diminish, and they're going to be checking this constantly with blood work. And the last one, a lot of the males like that type of treatment because it's the least invasive when it comes, through surgery type wise procedure. Also, they may not end up with erectile dysfunction. So I hope that this blog was informative. And if you like the content that you see, we're going to be uploading content in English and Spanish. So make sure to right now subscribe and make sure you hit that bell icon to receive all notifications. Please make sure you like our videos, because this is also going to help for the videos to be related in YouTube, and comment. And if you want to help this channel, make sure you share this video with your contacts and WhatsApp or in your Facebook wall. So until next time, this is Abner, and have a great day.